Hey, it's Dr. Evans. Ladies, I'm here to talk to you today about the Emsella and your pelvic floor. This is a topic that's really, really important to us because as we age, we usually can't escape some sort of pelvic floor dysfunction when we age. So women that suffer from things like urinating when we sneeze, or we're unable to jump on trampolines, or we have this urgency every time we walk through the door where we just can't wait to get to the bathroom, or we're going too much, we're getting up at night, we're breaking up our sleep, or we're feeling laxity during things like intercourse or just in general. Things and reasons why you're just not feeling yourself. These are all the things that your pelvic floor contributes to and ways that we can now help you with this. So what I first want to talk to you about is what's to understand about the anatomy. And I think the anatomy is important because when you can visualize where everything is, then it helps you understand why we do things the way we do as doctors. So this is your pelvic floor. So I want you to look here, know that this is your bladder. This is the vagina, and then this is the rectum. And they're all supported by what's called the pelvic floor. That's this muscle that runs from the mons pubis, which is that bone in the front, all the way back to the coccyx, which is part of your sacrum here. It's at the end of your spine. So again, that muscle transverses from here all the way back here. So as we age, that muscle loosens. As we get pregnant and give birth, that muscle can loosen. So all those things affect how we feel. So now again, let's look at a different view. That same side view, what happens when you turn it towards you, and you can look at it from like the bottom up. So this is the pelvic floor anatomy. And what you have again, you can see what's supported: the vagina, the rectum, the bladder is in top. And again, those muscles run from the top all the way down to the bottom, okay? So again, it supports those pelvic floor muscles, again, bladder, bowel, vagina, and uterus. And what they do is that they help prevent incontinence, not only of the bladder, but also of the rectum, okay? So, and these are the same muscles that helps with pelvic grip during intercourse. So this is why they're important during sexual function, okay? So again, how do you strengthen a muscle? You have to exercise it. So there's various ways to exercise it. Everything from doing Pilates to doing floor exercises to actually working with a pelvic floor therapist. But one of the best things that helps target these muscles, and again, specifically these muscles, is your Kegel. You have to do Kegel exercises to affect these, okay? These are actually independent from holding your breath. What you do is you focus on specifically those muscles and you help tighten them up, okay? So again, you can fight incontinence as well as improve sexual function by tightening these pelvic floor muscles. Now, what's the best, easiest ways to do this? I mean, you walk into an office, you come out Kegel-fied. I know that's a new word, ignore that please. But nonetheless, literally you're affecting those muscles to the nth degree. How do you do that? You do that with the Emsella. This is groundbreaking technology, everyone. So the reason which makes it so special, right, is because when you do Kegels, you got to kind of think about it. So when you think about your Kegels, you think about it and then you got to rest, and you think about it again and then you got to rest. So you end up with these little puny contractions. Now, what happens when you sit on the Emsella? The Emsella, you sit on it, it uses supramaximal contractions. What that means is those are muscle contractions that you don't even think about. You just sit there and the machine does all the rest of the work for you. So again, you sit there and it exercises it for you. Again, and it exercises it for you, okay? Again, supramaximal contractions, okay? So again, these are something that you can't think about. So let's look at one of the videos that demonstrates this, okay? This is something provided by BTO, which again talks about the Emsella. This is what's going on behind the scenes, okay? So this is the device. Someone comes in, they can be fully clothed when they come in. This is for men as well as women. And what happens is you get these high intensity focused electromagnetic energy that exercises this pelvic floor muscle. Again, from the top to the bottom, it exercises it. And you can even see here by ultrasound how it exercises those muscles, okay? So again, it can do 11,000 of those in a single session. And then after you're done, after those 28 minutes, you just get up and then you're all set with your treatment for today, okay? Again, now we're done, okay? So how do the treatments work? You get 2 treatments a week for 3 weeks, so a total of 6 sessions. That leads to a 95% improvement in stress incontinence. Now, that's shown by studies, okay? So again, I, of course, had to test it again. I work with other doctors on this project. And again, we did a multi-center study looking at the long-term effectiveness of this HIFIM in treatment for urinary incontinence as well as sexual dysfunction. And now, what are some of the things that it showed? So when we look at one of the questionnaires that we administered, the Female Sexual Function Index questionnaire, it looked at various things associated with sexual function. So things such as desire, arousal, lubrication, orgasm, satisfaction, pain, improvement of pain, that is. It showed an improvement across the board after treatment with the Emsella, right? So we already know it helps with that incontinence. Now I'm telling you that yes, it also helps with sexual function, okay? So find out more about the Emsella. Super duper easy treatment, right? There's supramaximal contractions. You get a total of 6 treatments with this. You stay basically fully clothed for the procedure. And again, it's the Emsella. You can find out more at sugarlandmedspa.com. We're here to help. Thank you.